All right, Safety Net team. We're at 1:45, and that's time for us to recognize. You can't hear me? Do I need to be in the middle? Maybe that'll do it. All right, Safety Net team. It's 1:45, and that means it's time for us to recognize some new attendees who are with us here today in person. We also have, and I don't know if Aaron knows how many we have joining us through our hybrid. This is our first time not only here at Lakeside Christian, but also the first time we're here for a hybrid meeting online as well as in person.
6 people online and it's working.
How great is that? Yeah, that's fantastic. Thank you, Aaron. Okay, now back to business. Surely I know we have some new attendees here today at the Safety Net Alliance. If you would like to raise your hand, or, well, let's not raise our hand. Let's just stand. If you would stand and say your name, and we'll start by tables. How would that be? Your name, your job title, and the organization. And if you're looking to connect with someone today, that would be a fantastic place to start. So let's start right here at this table in front of me. Is anyone new? No? Oh, that's home, folks. And this table, anyone? No? Let's move right on along. We'll just go right on down the line there. Anyone new? Yes, here we go.
Hello, everyone.
Push the button. Here's the yellow one.
Test.
Okay, wonderful. Hello, everyone. My name is Natalie. I am the FSS coordinator with the Housing Authority of Covington, so I handle our family self-sufficiency programming. I'm not currently looking to connect with anyone in particular, but it's really wonderful to meet you all and to be here.
Thank you.
Hi, everybody. I'm April Peacock. I'm also with the Housing Authority of Covington. I'm the program manager. I'm really eager to just hear about what we got going on in the area so I can help my residents. Thank you.
Thank you.
Hi, everybody. I'm Jacqueline Gleason. I'm with CHNK Behavioral Health. I'm a business development clinician, and I will be up on the panel today talking a bit about programming. So if anybody wants to connect or has any questions, I will speak with you soon.
Hi, I'm Rosemary Fugate. I've been here before, but my title has recently changed as well as my employment. I'm at Welcome House now as a Rapid Rehouse Service Coordinator. I'm not looking for anything to connect as I'm still fairly new to my role, but I'm interested to learn from you all today.
Anybody doing this one?
Hello. Sorry. My name is Danae Edelin. I'm the new executive director for NAMI Northern Kentucky. NAMI Northern Kentucky. So I'm new to Northern Kentucky, so I'm glad I made it here in person and looking forward to working with all of you as it relates to mental health.
Thank you.
Hi, everybody. My name is Josh Pilcher. I am the volunteer coordinator at Mentoring Plus. We are a youth program for kids aged 13 to 18, trying to help them, the at-risk teens in Newport, Kentucky. I'm looking to connect with people who are interested in volunteering or know resources for volunteers or resources for our teens at risk. So thank you.
Hi again, I'm James. I'm not new here, but I do have a new position. I'm now the program Working? Okay, sorry about that. I'm now the program director with Mentoring Plus. I'll just speak really loud. I'm now the program director with Mentoring Plus, so I'm looking at anyone who wants to volunteer, same as him, and see if we can get more resources for our kids.
Hi, my name is Megan Lentz. I'm actually not new here, but it has been many, many years. I was the Campbell County manager for NKCAC. I actually now work at Gateway. I'm the student support and engagement specialist. It is a fairly new role. It's a fairly new program, so I'm just here to learn from everyone and looking forward to getting to know you all again. And so hi.
Thank you.
I'm Therese San Germano. I am new to my position, but not to my agency. I'm with Big Brothers and Sisters of Greater Cincinnati. I am currently the director of, it's a long one, Quality Assurance, Collaborations, and Partnerships, and Resources, actually. So anyway, I'm here to connect with, I would love to talk to that rapid housing person from Welcome House and you from Gateway. And we are currently updating our resources and building new partnerships. And come talk to me. Be happy to talk. Meet you.
Awesome. Welcome.
Hi, I'm Jennifer Miller. I'm the Chief of Services and Development at North Key, and I'm also going to be speaking a little bit later. So if you have any questions for me afterward, please let me know. Thank you.
Anyone else? Awesome.
Hi, I'm Ashley Reeves. I am the Director of Intake at Sun. I am also on the panel today, so looking forward to talking with anybody who has any questions.
Hi, my name is Abby Weber. I'm one of the social workers with the VA HUD-VASH program, and I cover a lot of the more rural counties of northern Kentucky, so like Grant, Bracken, Gallatin, and Pendleton counties. So I'm definitely any resources, especially food, housing options, things like that out in those areas. If those are available or anyone knows of anything, I'm definitely open to learning more about those just so I can, because we're struggling to find those resources for our veterans in the more rural areas. So if anyone has any of those resources, I am definitely open to learning more about them.
Hello everyone, my name is Sarah Schwabel. I am the Director of New Season Treatment Center. We're an opioid treatment facility over in Covington. I am looking to connect for anyone with resources. I'm really open to anything in the area. I'm fairly new to northern Kentucky, so I'm more familiar with Cincinnati. So if you're in this room, I probably don't know about you. So I'll throw that out there.
Good way to describe it. Anyone else? I think that's all of our new folks.
Thank you very much. Welcome to experienced Safety Net Alliance team members as well as new team members. Several of our new attendees here today are individuals that we just reached out to see if they would come and share with us today, and without hesitation, every last one of our panelists answered the call and is looking forward to sharing with us today. How great is that? One of the best parts of working in this field in Northern Kentucky, collaboration and just a great working relationship with everyone. Now, before we step on to reports, I am going to deviate for just a minute because on your tables, and here comes a little homework for you right before we get started. On your tables is a purple sheet that you may want to consider while we're going along here today. This sheet is from Kay Stevens, and Kay's at the very back of our room, and she's asked that we all complete these to return to her today. So this is a little bit of a warning to give us a head start so that we can be helpful for Kay and for the Kentucky court system. So that's a little bit of work for you while we're moving right along. Now, we're going to move right on, and we're going to head into some committee reports. I don't know if you're part of an affinity group yet, but there's some fantastic work that's happening, and we're going to begin by talking to Aaron with our executive committee. And Aaron, would you like to share a little bit with the group? I think, does Andy have that microphone, or I have one here? Aaron's multitasking. There's a surprise, huh?
There we go. Yeah. Oh, hot mic, hot mic. Woo. Thank you so much. We are so excited. I hope that the executive committee has been working really, really hard to be more inclusive as a safety net, to meet the needs of those individuals And so the move out here was a pretty big deal for us. We are so grateful to St. John's. They gave us 17 years in their location, and we are extremely grateful. But we felt like a move to be more centralized for people to get to, easier parking, and gave us some technological abilities was really important. So thank you all for adjusting with us. Thank you for adjusting to the time. I hope that this will create a more robust safety net alliance by making it more accessible. So just a reminder, if you can't be here ever, we are now live streaming to our webpage. It is not working today, but it does redirect you to YouTube, so you can watch, and we do have 11 people watching right now, so welcome to the people watching. The only other update that we really wanted to give today, nope, what did I do? Oh, the big thing that we're working on now is nominations are now open for the executive committee. We're working on a lot of other things too, but this is the most important. The executive committee is really the governing body of the safety net. We determine strategic direction, we make strategic decisions, and we do oversight and governance of the alliance, looking at our finances, as well as ensuring that we have a structure that does the right thing to serve everybody. It is decentralized, so all of our committees operate pretty much independently, but the executive committee gives them the support that they need. Any member is eligible to serve on the executive committee. We meet once a month at 8 a.m., the Tuesday before our Wednesday meeting, and we would really love diverse voices on that executive committee. So this is the one circumstance where it says nominations, but I'm going to encourage you to nominate yourself. There is no shame in this game, okay? You can nominate somebody else, and we would love that, but we would love it even more if you would nominate yourself. So we really want to add people. I think we'll probably be adding at least 5 or 6 people at this time. It is I think we have it set up as a 3-year commitment, then with another optional 3-year in our bylaws. Obviously, things change. We're not going to chase you down and put you in jail if you can't do it. But we would really love that. So please consider doing that. There is a QR code on the back of your handout sheet that is the nomination form. Just so you know, those nominations will close at our October meeting, and we will have elections at our November meeting. So elections will take place at our November meeting. Every organization that's a member gets 1 vote. So it's not everybody that shows up that day, it's every organization gets 1 vote. Does that make sense? Also at that day, we'll be electing the chairperson and vice chairperson of the executive committee. I'm currently serving as the chairperson of the executive committee. That was not voted on by the general public. That was what we did to keep us moving forward as we went through strategic planning. But going forward, that will be elected by all of you every year. So know that that nomination will be coming up too. If you think somebody would be great for those roles, we would love to hear about that also. I am not power hungry and hold on. I'm happy to do the job, but if there's somebody else that can do and serve, we would love that too. So please take your time and submit those. Yes, Alan has a question. Hold on. We want the people online to be able to hear.
It might be helpful if you say who's currently on it, and are people's terms expired, or is everybody eligible again?
That's a great question. So I don't want to take too much time. So no one will cycle off after this term, because prior to this, it was a little bit shaky as to what term limits were. So at next year, we will have people start cycling off that have been on it, because we don't want to have a mass turnover on the executive committee. We don't think that is best. We'll take as many nominations as we can get, and then we'll elect the best. But those that are currently on will not be coming up for election. So Lisa is on it, Kim is on it, Amanda Peters is on it, Andy Brunsman is on it. Who else is here that's on it? Karen Zengel is on it. Christina Powers is on it. Jenny Wiley is on it. And Bridget Stadmiller is on it. So those are the current members. The other thing we're really working hard on is the website is going to get updated really soon. And it will actually have those names and pictures on there so you know who to contact. But as you can imagine, that's a big undertaking. So we're still working on it. Any other questions? Nominate yourself. We'd love to have you.
Thank you, Aaron. Thank you. It's a great team to work with, as you already know. Okay, now let's take a quick look at member engagement, and I think, Laura, do you have a little bit for that?
Hi, my name is Laura Rigg, and I am the head of the engagement committee, and we have grown, which is really good news. We have a couple more people that are involved. So what we do is we want to engage everybody in the safety net. We want to make you feel comfortable when you come in, and we want to reach out to new members and make sure that we have those good coordinations, those good connections between everybody. So if you're interested in being part of the engagement committee, it's on the back of your affinity group. Go ahead, get the QR code, and we would love to have you as a member.
Thank you, Laura. Laura, when does the member engagement team meet?
The fourth Monday. So
Fourth Monday.
Fourth Monday of the month, so it's right after our meeting. We meet then and discuss the meeting coming up ahead and things that we would like to do, panelists that we would like to have involved in those meetings. It's really fun, it's a great group, so it's a good chance to be part of something that helps everybody in the community.
That's right. Thank you, Laura. Okay, well, let's move right on along to service integration. Amanda?
Thank you, Lisa. Hello, everybody. I'm Amanda Peters, and Lisa and I are co-chairing service integration. So this is a new committee that we've decided that came out of the executive committee strategic planning. And so what we're looking to do is really facilitate cross-organizational collaboration and look at where we can integrate services and provide better service delivery for all of our clients. We know folks go into one door and they need housing, they need food, they need transportation, they need some sort of health care. And so we're looking at how can we streamline that. And so what we've done as a first step is create a survey for members. So on your table, you'll find a sheet that looks like this. And this is just telling some of the things that we have met as a group and created a vision and a purpose, some objectives, and then our initial steps, and then our next steps. This QR code at the bottom is a survey that we would like everyone to take. And just to let everyone know that these are not set in stones. This is a committee that we're bringing to the full group. I did have draft written all over it, but you couldn't see the words. So if you have issue with this or you have feedback or suggestions, please come to one of the committee members. They are listed here at the bottom. If you're here on a committee, will you raise your hand? I know I see Maddie over there. There we go, there we go. And so feel free to see us. I put my email and Lisa's at the bottom, but we would love to have more folks. We'd love to have more organizations represented. And we also know that some of our organizations are very large. And if you can't speak for your organization, this is just a fact-finding exploratory survey. It does not serve as a commitment to do anything. And we are not going to take this back to your supervisors and directors and say, well, so-and-so said you're on board. This is just fact-finding. If you have any questions, please let us know. And we meet right now currently the first and third Tuesday virtually. But as we get rolling, we're going to go to once a month, and then we'll decide with the committee members whether that would be the first or the third at 10:30 on that Tuesday. I am going to give a shameless plug since I have the mic, is I hear lots of people talking about resources. I have my books back there. My office oversees a helpline. It says an addiction helpline, but we get calls for food pantries. We get calls for transportation. Now, one thing I'll say is that if it's not a resource, we can't create more housing units, but we can go and search wherever we can. I have Julie Hellman. Will you raise your hand? She is our regional resource helpline specialist. This is funded by the 3 fiscal courts in St. Elizabeth Healthcare. Your taxpayer dollars are paying for it, so essentially we work for you. If you need resources in any area, give us a call. Julie will go on the hunt for you and call you back. Sorry to take so much time.
I guess I'll talk. So external relations, Kim Webb and myself, our group has been meeting. We are working to finalize the press releases based off the micro grant safety net just got off. So thank you to our team, Sarah specifically. Thank you for helping get together after this to do it. And then Tess Brown, thank you for joining that crew to help us get it done. We do have a next meeting set. Our next meeting is going to be next Tuesday, August 27th. We are trying to keep that recurrence. I will send the invitation. I apologize, I'm running behind. Probably going to try to target around a 2 o'clock meeting time for that meeting again for our group to get to work. The executive committee has given the green light for our committee to work on a social media guideline for how we're going to get our Facebook page up and running for the Safety Net Alliance. So our group will begin working on that on the 27th, of coming up with kind of guidelines. Who's going to be our administrators? What does that look like? What kind of content do we want to post? And what kind of results do we want to get out of our social media activity? That is what is going on with our group right now. Remember, on the horizon, so coming in 2025, we hope to have that elected officials developed email list as part of what our group will provide to the safety net as well. But we are not going to do that till we know who they are, because there's going to be some turnover in those offices. If you guys have any questions for me or Kim or anyone on our committee, please reach out to us. We are an open door group, obviously. We want to hear from everyone. On your tables, again, just like every group, is a way to sign up. Please, please, please hit that QR code. And if you want to be part of our group that's really trying to focus on how we represent the safety net out in the community with all of our external partners, we would love to have the more of us, the merrier. So thank you guys for all your work on there.
Fantastic. Thank you all so much. Now, we have also Community Impact, and Jenny Wiley leads this group. I believe that Jenny's having a day away from the desk, and so we'll hear from Community Impact on the next go-round. Unless there's someone here who's part of the Community Impact team that would like to provide an update. Does anyone have an update for Community Impact? Oh, here we go.
That's
here we
what
go.
we like to see.
Here we go. That's vigor
the
right
safety
there.
net spirit. Coming to you.
Thank you.
Hi, I'm Grace. I am one of Jenny's people on the Community Impact, but I also am with Building Community Wellbeing as the systems connector, so this is kind of my job to talk to people. So our committee, and we haven't super finalized it yet, but we're looking at how do we collect data amongst each other, because we all have different datas that we are working with. And so to measure impact, we first want to know what are we actually collecting, who's collecting what, and how we're going to do that is going to be through a survey, but we also know that other people are doing surveys. So my pitch to the executive committees is if we could combine powers and do one survey and that kind of stuff. Jenny has not signed off on that, but that's my personal pitch.
Fantastic. Fantastic. Good stuff's happening all across the Safety Net Alliance. All right, now let's take a few minutes to hear from you about announcements that you have. I have to say it right off the bat, this is not a fundraising opportunity, I apologize. But it is a time to share some general news or updated programs that you'd like this group to know about. Is there anyone that has something they'd like to share? Yes.
I'll get over to Teresa. I'll walk while I talk. So Be Concerned still has its Erlanger food pantry that's going on, no longer in the United Ministries building, but at the Erlanger Lions Club. Anyone out in that area, Erlanger, Ellesmere, Florence, Boone County, that needs help can sign up to go to that. It's on Mondays from 12 to 3, and we build our entire food pantry out there at the Lions Club, and families are able to walk around and make their selections. My team at Be Concerned is still looking for partners in that part of town, Erlanger, Ellesmere, Boone County. We have a meeting set up with like the Boone County Sheriff's Office and Laura Plyman from the fiscal courts, but we know that there's more outreach that needs to be done. So if you are a Boone County or Erlanger or Ellesmere place that wants to do something with food for the community you serve, please don't be bashful to reach out. In Campbell County as well. We know that there's a lot of congruence between like what we do with Brighton Center, and I talked with Eric yesterday. We're trying to be strategic while we wait for the big food survey to come back from the ad before we all start launching multiple food outreaches, how we can maybe do more with more for more, and how can we maybe as a safety net food community launch some of these together in tandem to where it would be like the food committee presenting a food giveaway at, say, a trailer park in Florence one day a month as a safety net kind of service we provide as a group. But if you're interested in that, please talk to our team. Over the next 12 months, we've gotten some financial support from the fiscal courts and other places to continue pushing this, not only for senior citizens, but also the mental health bracket, which is folks that are 59 and below. So please let us know if you want food outreach. We are trying to get those scheduled strategically over the next year so we can have more of a constant presence in certain communities around the river cities, specifically so they have a food source once a month in their community.
I want to be part of that because we only do ours once a month. So hi, I'm Teresa from Fiesta. Hola. 2 events. This Friday is Hispanic Heritage Night at the Florence Yalls, and I can take up to 1,000 people. they were like, how many tickets do you want? I said, I will get you a lot of people. So if anyone wants to go, have a really good time, see some fireworks, hear some Latin music. It'll be salsa, merengue, reggaeton. We had a great time last year. I brought in about 300 and something people, but I really want them to see that there's a big presence. So if you guys want to come, just reach out. We have tickets. But if you have families that you serve that are Latino families, a lot of them have never been able to have an experience to go to a baseball game. They're giving popcorn and soda and a pass to go to the children's play area. So that's really fun for the families. So if you have anyone, reach out to me. I can give you my card, and you can just email me. And then the second thing is in September 21st, is our big annual event at Ignite Institute. Last year, we brought in over 300 people, and I'm looking for resource tables. Right now, I think we have 20 resource tables signed up. We're looking to get, last year we had 28 or 30. We're looking to get more than that this year. And we're hoping that the amount of people that come to our event is a little bit more. We provide childcare, we provide lunch for everyone, and workshops for the parents. So if you're interested in having a table, it's free. Please reach out. So thank you.
Hi, I'm Wendy Barnett Burke, and I'm with Florence Christian Church, Fresh Start Shower Ministry. August 29th, we are holding a vaccine clinic from 10 to 2 through UK Health, and on September 21st, we are doing a soft launch of our community healthcare clinic that will be once a month for our underserved, underinsured folks. The September 21st soft launch, we're only having about like 10 patients, but after that, it's going to be way wide open, and it is the med students from NKU's UK. So.
Hi, Rebecca Bolins with Brightview. I'd like to invite you all to our documentary that we are hosting. It's Addiction Ultimatum. It is at the Woodward Theater on September 18th. It's a story of addiction and hope, and it follows several people. And if you have any questions or any information you need, I put some over there, but we'd love to have you all come. It is free.
Hi, I'm Katrina Harris Green with CareNet Pregnancy Services of Northern Kentucky. In the past couple weeks, we've started offering prenatal vitamins to any woman coming into our clinic for pregnancy services. So if that is a need, we have an abundance of infant formula right now. So if you have clients that are struggling to find formula or baby food for their babies, you can send them our way. All of our services are free. And we also offer several different forms of parenting classes from pre-birth up through adolescence.
Hi, New Season is doing an open house on September 18th, so I'm inviting anyone that wants to learn more about addiction, more about opioid treatment. We're doing that from 11:30 to 1:30, I believe. So.
Hi, my name is Anisha Mosley. I'm with the Life Learning Center, and on September 12th, we will be hosting our first annual recovery event called Rock and Recovery. There will be hot dog, we're going to do pizza, pizza. We'll have a toy drive. We'll have before and after pics of people in recovery, and come join us for that. Thank you.
Hi, I'm Kim Harrison with Rooms with Love Furniture Ministry. So we help those that are starting over fill their homes. We have recently moved our referral process to online. So we're just trying to communicate that. There were forms probably floating around. If you shoot us that, we direct you to how to make an online referral. So thank you.
And
Lisa Stenner at Union Presbyterian Church at Abraham's Pantry. I'll send this out on the alert, but I dropped off flyers there's a community service day in this area. It's a collaboration with our congregation, the Church of Jesus Christ of Latter-day Saints, and St. Timothy's Catholic Church. The Resource Festival will be across the street at the steakhouse of the LDS, and then there'll be some on-site projects there for folks of all ages with local mission agencies, and there will be some off-site projects in the afternoon. That is Saturday, November 2nd. And then Saturday, October 5th is the first annual Boone Pride Festival, and that will be at Stringtown Park in Florence. There is sign-up information. You can also go through the Fairness Campaign's website to sign up for that event, and it will be from 11 to 2.
Well, since I mentioned earlier that I'm new and we're creating my program, I thought I'd tell you guys a little bit about it. So I'm at Gateway, and I'm a re-engagement specialist. And my job is, well, let me give you a little bit of backstory. Sorry, I got nervous. There's an epidemic in the United States of adults that have started degrees and not been able to finish them, whether that's because of family responsibilities, they have children, funding ran out. So across the nation, all of our colleges are trying to address that, trying to get these people back in and help them to succeed, because they still have to pay these bills. They still have to pay for the college that they've started and not been able to complete. So at Gateway, we have started this initiative also, which created my job. I help people that have started college and dropped out to re-engage, to reapply, to be successful this time around. So we are still creating it, but if you have any students that are interested in Gateway, I'd love for you to send them my way. I'd love to help them out. So thank you.
Any other announcements? All the way up front. Okay.
Hi everyone, I'm Becca from St. Vincent de Paul, Northern Kentucky, and we are winding down our Summer Breeze program, so I just wanted to give an update on that. We are out of air conditioners, but we do still have fans left available. Northern Kentucky neighbors in need can come to our Erlanger location right down the street, 2655 Crescent Springs Road, Monday through Friday from 10 to 2 to receive a fan. Just have them bring their ID or a proof of address or something like that. And then they can call the helpline to check eligibility. Thanks.
Other updates?
All right. This is our last call. Well, here's the good news. There's lots of good stuff happening. I can't believe we're already talking about fall events, but certainly we are. And here's more good news. We are pretty close to being right on time. How great is that? So I'm going to take that as a big win on a Wednesday. Now, as we all know, mental health concerns throughout Northern Kentucky are a hot topic across the nation, really, that's for sure. And today, our panel is going to be focused on speaking about mental health. So at this time, I'm going to relinquish the mic and hand this over to Kim, who will invite our panelists. Thank you, Kim.
Thanks. I'm going to add one announcement. The Emergency Shelter of Northern Kentucky is still in men-only facility at night until November 1st, and we will bring our women in overnight. We have a multitude of programs, mid-level initial emergency shelter, long-term housing work program, but also a daily shower and laundry program that is becoming very, very popular. We have a holistic approach, so we have on-site health care and partners that are using that space as well. So street outreach is also really active, so if you're here and you want to connect, Tina Howard, where you're sitting in the back, she can answer your questions about our services. Daytime services are for all adults. Currently, overnight shelters for men only, and we are prioritizing those with the Kentucky ID in hand. So with that being said, I really don't want to stand up here because I'm already tall enough. I have the privilege and honor, I work with many of these individuals on a daily basis, on a weekly basis, as our community continues to address the mental health crisis. and how do we collectively collaborate and coordinate services for the best impact, not only for folks that we see, but as our community as a whole, for our individual families. So with that being said, I'm going to invite up Jacqueline Gleason. She is with the Children's Home of Northern Kentucky. She's going to share information with us about the new facility in Grant County that they just announced, who they serve, and how they're moving to the behavioral health and outpatient services they provide. So Jacqueline, you want to come on up? And she's also going to invite she's got an event that she's also going to share. We also have Jennifer Miller with Northkey, who's going to share the incredible work that they've been doing to address mental health, substance use disorder, and intellectual developmental disabilities, which I think is often overlooked in our community as well. They're also the folks that answer the 988 number that we use here in our community. So if you guys want to come up and have a seat. We also have Ashley Reeves with Sun Behavioral, who's going to share about their services, their assessments, their role in the community mobile assessment, 24-hour, 7-day-a-week services, how to request mobile services. I think that's a big topic of discussion all the time, so she's going to go ahead and discuss that. And then lastly, the challenges of turning the page over and upside down. We also have Rick Palmer with Mental Health of America, Northern Kentucky, Southwest Ohio, who is going to talk about their general services, their educational opportunities. This is a great resource. I know we at ESNKY look at their services and their resources to train our staff as well. And then we also have Laura Rigg with St. Elizabeth, who's going to talk about the wide variety of services that her team is providing in primary care throughout the region in terms of mental health services and, just incredible amount of work on a regional level. Continue to look for, I know there's a mental health conference that we've had in the past, and we continue to do work in this field. So these are the individuals that were gracious enough to provide some time. Going to ask you all to just spend a few minutes talking about and answering the questions about your programming and what you do. And then we will open up the floor for questions that you can direct to all of them or one of them as it relates to your work. Okay. So unfortunately, you guys are going to have to share. No, that's fine. Yeah.
Hello.
Okay. Yeah, go ahead.
You go right ahead.
Oh, okay.
I'm just testing Mike.
Okay. I'm Ashley Reeves, and I am the intake director at Sun. We provide mental health services at and substance abuse services at inpatient level of care, and we have a partial hospitalization and an intensive outpatient program. We provide 24/7 assessments at Sun. We operate pretty much like a psychiatric emergency room. You can come in anytime. You can also call anytime, and there will be somebody there to answer and to help you figure out what those next best steps are. So we provide a level of care assessment. So we're going to, and that process, I think one of the things Lisa said is people are a little bit leery about what that process is because it's hard to walk into a mental health hospital, right? But in the intake department, we are offering an assessment. We're just going to sit down and talk to people, really, and talk about what's going on, what kind of symptoms have you been having, what kind of services do you already have in place, what do you need, what are your goals, how can we help you? So we will sit down and talk about those things and then determine what would be the best level of care for you. So that could be inpatient if you're in like a crisis situation, or if somebody's needing to detox off of some type of substance, so it could be inpatient, or it could also be partial hospitalization, which is a program where you come in every day and get group therapy during the day. You see a provider weekly, and then you go home at night. So that's why it's partial hospitalization. The daytime is similar, but at night you go home and sleep in your own bed. And then intensive outpatient is a service that meets, we have a daytime and an evening intensive outpatient program. So it is 3 hours a day of group therapy. So that is another service that we provide. We also have an acute rehab program, which is for people that are struggling with substance abuse. If they are, if they have detoxed and they need a little bit more stabilization before they either step down to partial or go to a residential facility, we do have a service that can kind of bridge that gap. And it's typically like a 7 to 14 days rehab stay before they're a little bit more stabilized. One of the other questions was about insurance. We have financial counselors that meet with everybody that comes into our intake department. If somebody does not have insurance, we will try to get them connected. Actually, I think I saw Vicki in here somewhere, but she is our connector, and she helps us to connect a lot of people to Medicaid. So we do have that service available. Vicki actually comes into our hospital and meets with the patients there. We have, she helps us out a lot, and we do get a lot of people connected to insurance that way. I think that's generally it. Are we just all talk, or do you want, keep going? Okay, all right. Okay.
All right, well, I am Jennifer Miller, and I am the Chief of Services at North Key Community Care, and we serve the 8 northern Kentucky counties, and we do have a physical office in each of those 8 counties, so folks are able to get services on site wherever is closest for them, and we also offer telehealth services for most of our services that we offer. So with that, we are the Community Mental Health Center, which means we offer all levels of outpatient treatment. So once they leave Sun and are no longer in need of an inpatient or partial hospitalization level of care, they can come to North Key, and we are able to provide outpatient therapy. We will provide we also provide IOP. Ours is specific for substance use treatment, and we do 5 days a week and then step down to 3 days, then 2, then 1. So it's a full 6-month program that we can offer for that. We also have psychiatric providers that can do medication. We can do that from as young as 4 or 5. 5 is generally the preferred age, but in some cases as low as 4, all the way up through end-of-life care for psychiatric needs. We also provide basic support services like case management, peer support services, so folks who are in recovery themselves, either with mental health or substance use disorders or both. We also provide a lot of specialized services for our kiddos. We are in a lot of the local schools, but we also will provide outpatient services for them. We have specialized high-fidelity wraparound, which is specialized case management for more of our high-need adolescents that we're able to provide with their support system. So we try to involve as many folks in their natural supports as possible to help prevent placement out of the home, so trying to keep them from going into foster care or residential treatment facilities. We also have a large variety of other services. You can come for housing specialist support. We don't provide housing. I wish we did, but unfortunately we don't do that, but we do help people get connected with that. We have supported employment services. We have assertive community treatment, which helps us with folks who may be struggling with going in and out of hospitals, emergency departments, jails, things like that, to help them stabilize and maintain in the community. And then we have a lot of crisis services. So you heard mention that we answer the 988 number. So if you're not familiar with 988, that is the mental health equivalent of 911. And so wherever you are on your phone, you can just dial 988 and you will be immediately connected to a crisis counselor who can help you work through whatever it is that's going on. Certainly that can be suicidality or homicidality, but it can also be that I'm having a panic attack and I don't know how to manage. It can be that you're worried about someone else in your life and you don't know how to get them help. You can call and we can help walk you through that as well. That is available nationwide, so anyone can do that, but we get the calls for our 8 northern Kentucky counties, and we do a lot of connection with resources for that and try to get folks connected with what they need. We also have our regular North Key crisis line, which is available to anyone in the community as well. You can call us anytime, 24/7, and get connected to a member of our crisis team who can help you figure out what next steps you may need. We are also very new in rolling out our mobile crisis services, where we will actually go wherever the person is in the community who may be in crisis and help them figure out what their next steps need to be. We're not fully staffed for that yet, so I can't promise you that if you call us that we'll be available 24/7 right now, but that is our aim, and we are available and starting to do that service now. So you can reach out and see if that's an available option depending on the time that you may be with someone who is in crisis. We have a lot of other things, but that's a pretty good amount of information, I feel like, to start you off with, and certainly welcome anyone who may have questions to find me after.
Hello? I'm going to use yours.
It's working.
It's working? It is? Hello? Can you hear me now?
Did you turn it off?
I don't think so. No. I'm going to use this one. Okay. That one's working. Okay, I'm Jacqueline Gleason. I'm with CHNK Behavioral Health. We have been around for quite a while. Our name doesn't really serve us, though. So a lot of people maybe in this room even may think that we only serve children. And we really are trying to move away from being a child welfare organization to a more robust healthcare organization. So some people refer to us as chunky. We're trying to get away from that as well. So CHNK Behavioral Health. We serve clients mainly 6 to, we now are paneled with Medicare, so that's really exciting. That is something that is new for us. So 6 and older. We just opened, so this is something that I wanted to plug in today, is we just opened our second outpatient office in Grant County, so down in Williamstown, Kentucky. We really saw that there was a need in the more rural communities, especially during COVID, as a lot of us have seen, we were provided telehealth services, and, we really wanted to get in person with individuals in that community. So we're already partnered with Grant County Schools. We currently provide IOPs in 12 schools in the northern Kentucky area and in Grant County. We're embedded in about 22 schools. So on our continuum of care, we have individual family counseling, very similar to my friends up here, individual family counseling. We provide medication management, ages 6 to 64 for that. Targeted case management, family preservation. That's a program that's pretty near and dear to my heart. I used to oversee that program. Those referrals come directly from DCBS. So if there is a family with an open case, the goal is to keep the family together, so to keep the children in the home, or the goal is to help reunify the children if they're coming back from a placement. So we do provide residential treatment as well. As a lot of us know, the goal is to keep the children in the home. Last place, kind of the last place we want to be is in residential treatment. So we have programming to keep kids out of residential treatment, even though we provide PHP. Currently, we have, it's always changing. So currently, right now, we're accepting adolescents 12 to 17 on our Covington and Burlington campus. And then in the fall, we're looking for more like middle school. We're going to accept younger kiddos, elementary and middle school. But if you have any questions specific to criteria for that, feel free to reach out to me after, ask questions. I left my card in the back as well, because, there's always seems to be questions on how to refer to residential treatment. What else can I say? So that is really what I wanted to focus on today, is our Grant County office. So we had that open house. It was actually last week. We were trying to figure out a date, but anybody can make a referral. So if you have clients that are in Grant, Carroll, Owen, Pendleton, even Walton, Verona, that's a great place for them to go for outpatient treatment. We are in the fall, so in a few weeks, starting an adult IOP, SUD IOP, in that Grant County location. So I remember somebody said that they were with the VA looking for more rural treatment. I don't know who was out there was saying that. This could be a great opportunity for anybody that you work with that's seeking that level of care. We do also provide in our Covington location adult SUD or adult PHP and IOP. And adolescent IOP as well. So anything specific you have, any questions you have about programming, feel free to reach out. I left our continuum of care in the back as well. We're fortunate enough to really collaborate with a lot of people in this room, and that's really, I think, what makes the best outcome for the people that we serve is working together. So thank you all for what you do, and we look forward. We're always looking for new and exciting collaborations, so yeah, reach out to me if you have any interest.
Hi, I'm Laura Rigg, and I am a team lead for St. Elizabeth Physicians Care Management Department. So anyone that's involved with St. Elizabeth Physicians, if you are a patient there who has lots of services that a lot of people don't know about, one of them being short-term therapy. I am a therapist. I work in the office 3 days a week. I'm in the Turfway office, if you ever just want to see me. Just stay high, you know. But every single St. Elizabeth Physician's office is covered by a social worker that provides short-term therapy for 6 to 9 months to any patient of St. Elizabeth. We do have pediatric-specific people who will work with kids who are younger. I'll see down to 3, all the way up to I have a 90-year-old that I'm seeing now, so any age we will do. This is a service that, it is a billable service that we do have a charge with it, but typically we would do it through something different, so we don't use other people's insurance benefits for psychiatric care. We bill under something that's called behavioral health integration. Most people get a $0 copay. This is a new program we're doing. We're just now starting this whole billing process. But with that, we have seen most people get a $0 copay. So we're there to help for multiple different things. We see people with anxiety, depression, stress. If they do have long-term needs, because most people who have worked in the mental health field do know that people have, long-term PTSD, major depressive disorder, different things like that. We can help them and get them onto the long-term care that they need. And we do partner with most of the people up here on this panel to help get people the assistance that they need. It's a great program. We have 23 therapists right now that work in the office and cover all the other different offices. All they need is a referral from either us or their physician to get to see us. But we also have other programs that we have. We have an outreach providers. Laura Guffey is one of them. She's sitting right over there if you need her. And we can help with things like housing, food, insurance, anything that they need, SNAP benefits. So we have that as partners as well. We also have a pharmacist on staff that can answer any questions. We have dietitians on staff that can help people who are having, eating difficulties with depression. We all know comes a lot of not eating correctly or not eating right, having them see that. We have respiratory therapists on staff. We have emergency food that's donated through the free store food bank that we have at each office for patients. So if your patient is in a hard way and says, hey, I just need an emergency box of food, do you go to St. Elizabeth Physicians? We have that sitting there that they can go walk in and get. We have lots of different services that we provide, but we're very proud of the counseling services that we have. They're very good for helping get to long-term services if needed, or helping with a lot of different avenues we have. But we can cover a lot of different things in that with the help for insurance. As we all know, we get a patient comes in and they have multiple needs. It's not just the depression, it's depression and they need SNAP benefits, or they need housing, or right now they just can't seem to afford the $75 copay to keep going to this place or another. So that is one thing that we can help there. All they have to do is call the care management line. I will have my cards if anyone has any questions or would like to figure out how to refer patients to our care.
Such a wealth of knowledge for sure for everybody. We have a few minutes to ask questions, and we'll have mics out, and Andy's got his running shoes on if he didn't leave already. And do you have the mic back there, Andy? A couple of other things we want to point out on your agenda that you received. You're going to see there's some additional websites. I know ESNKY staff has really been leaning into some of these sites, not only to help the guests that we serve, but also as staff, because this work is really hard, and a lot of us focus on making sure that our staff is taken care of. So you're going to see the Northern Kentucky Helpline is listed there. Be really helpful just to pull these down and post these at your workplace as resources. The suicide hotline number. Another one that is really gaining a lot of traction right now, and I encourage everybody to look at it, is findhelpnowkentucky.org. This is a statewide site that has really picked up a lot of steam. It offers, it's a searchable site. It is for across the state. It has mental health services. It has substance use disorder facilities. It has naloxone sites and things like that. It is an excellent site. And the last one is another one that's really picking up, and St. Elizabeth has started activating hope. And this is, we'll send these links out directly too after the meeting, but these are some great websites because we don't have to know it all. We just have to know enough to be able to connect people to those who know it all. So with that being said, we have about 10 minutes. We can take some questions. Anybody having a question for any of our panelists? And if you would like it general, just say general question and I can hand the mic off. Or if it's for someone specific, I can hand the mic to them.
Hi again, my name is James. I did have a quick question for both Ashley and Jennifer. You had mentioned substance use treatment. Is any of that geared toward youth? Because I'm currently looking for any resources I can get to help my youth who have addiction issues.
Yeah, so from North Key side, we do not have groups for adolescents for substance use, excuse me, but we do have individualized therapy that is geared towards substance use for adolescents. Additionally, we also have a youth treatment coordinator. Her name is Angela Fox, and she specializes in adolescent substance use in the region and making sure everybody gets connected to resources. So she would be a great person to get connected with for more information as well. Oh, Ashley, sorry.
That's okay. At Sun, we do not currently have any adolescent substance use services, but we are always looking for feedback from the community about ways that we can make our services more robust, and that is a need that we have been hearing very frequently. So no, not yet, but keep an eye out, and I think if we do start some kind of program with that, then we would certainly let everybody know about that. I am aware that that is a need for sure, so yeah.
At CHNK, we do provide substance use SUD IOP for adolescents, so it's ages 14 to 17. Most of the clients in that group are dual diagnosis, so the SUD diagnosis can be primary or secondary. We utilize the evidence-based practice of 7 challenges. So if there is substance use for the client, we will utilize that curriculum in the group.
I also wonder if Find Help Now Kentucky would have that searchable feature for adolescents in the drop-down.
I think I utilized that once, but I think one of the services they were closed, and then I think I heard about so I was going to follow up.
Yeah, no, it's great. Right, and I do know, like in the state, as of July 1, there is a certification process now for sober living housing, which is in the SUD area, so we have seen a reduction in those services as well here. So, any other questions? Wow, you guys did amazing. Amazing. I guess we're done with that. Lisa, do you have anything to add, or? Oh, thank you so very much for taking time out of your day to come and engage. We hope to hear more from you all, and feel free to use the Safety Net Alert system to really lean into this, because Safety Net Alert system is for everything other than soliciting for funding and job postings. But any alerts that you have for services, so should the mobile house get full time, and you can do that, this is the best way to reach our direct service providers and our agencies. So, absolutely.
Okay.
Sorry. I do want to say, too, that there is some cards back there for we work with North Key and St. Elizabeth through a grant partnership called the CARES Grant. And as part of that, we have a mobile assessor as well. Currently, she is able to serve adults in Boone, Campbell, Kenton, and Grant counties for mobile assessments. And we have her cards and her contact information in the back.
If you knew me, you knew I would never stop talking unless someone took stuff away from me. But I think one of the big things to be aware of, and I tell this to all people when I meet and tell them about our programs, is when people come in with needs, assess their mental health needs as well. And I'm sure that a lot of you guys are doing that now, but it's one thing to really pay attention to. Because if someone comes in for food, yes, that's stressful, but what else is going on? What led them to this? What do they need help with? So doing, I know in our field we do PQH9s and GAD7s all the time, which are little screening tools that we can do for people's mental health. If you don't do that, advocate for it. Advocate for a patient when they come in, or a client when they come in, for you guys to see how are they doing. Are they depressed? Do they have heightened anxiety right now? And how can we get them to help? Because you guys see them when they're at their lowest sometimes, so it's good to know that they have other resources that you can reach out to. So never forget to check on their mental health when they come in just for basic needs.
And also as an employer, utilize the EAP. If your insurance provides it, the Employee Assistance Program is another option. I know sometimes I have staff who are not necessarily comfortable going to North Key or accessing the 988 line, but feel more comfortable going through the EAP because that is confidential. So I don't want to lose sight of that option as well. At this point, I'm going to turn it back over to Lisa because I think I've kind of done my job, and I'll let you take it. Thank you, everybody.
Thank you, Kim. Go back to your seats. There you go. I'll release them from the hot seat here today. That's right. Thank you so much, ladies. All right, now we're winding down, but it's time to talk about challenges, trends, or advocacy. Does anyone have any challenges or trends that they'd like to share with this group that you're seeing in your work that you'd like the safety net to be aware of? All right, I'm going to tell you a trend right now. You have one, Kim? You got to press the button, I think. You want mine? Try this one.
It says it's red.
There we go.
A couple of things. One is, I want to keep everybody aware, housing is a big topic of conversation in our community. And our elected officials in Northern Kentucky Area Development District have really championed this effort, and there are a couple of things that you probably have seen. They are doing a lot of get-to-know sessions out in the community because they want to hear from the people who are struggling with housing. Our community has also started recognizing, and I don't want to go into all the stats because I can barely remember some of the ones I know, but there is a big study that was released, and it has been acknowledged that housing is not a poverty issue. Housing is an income issue, and we need to have income-aligned housing or wage-based housing. Some of the comments have been, a home is where a job goes to sleep. And when we start recognizing, and our community is recognizing, the lack of housing for someone who's in the 40 to 60,000 range, or someone who is a senior citizen that is struggling with homelessness and becoming homelessness, or an 18-year-old or a 21-year-old just graduating from college making $60,000 cannot afford to live in our community. This also becomes an economic development and a workforce issue. There is a lot of good movement in this area, and one that we should be really proud of, because on a state level, not every community is doing it. Is it going to happen overnight? No. But can we continue to support our community in advocating for people that this is a housing problem? Homelessness is a housing problem. Hunger is a housing problem. So all these things, and this is going to continue to pick up for us. So that's the first thing I want to bring aware, because several of us sit at tables where we're having this housing conversation. 2 is House Bill 5 and the anti-camping bill. When I leave here, WVXU is coming on site because they're doing the checkups now to see how our community is doing with the legislation that was passed and went into effect on July 15th, I believe, that individuals that are without housing cannot sleep on public or private places. And the rule is that they have to warn, cite, fine. And so it's going to be very interesting to see how this plays out in our community, because as we've all heard, not every community has a shelter, but every community in every county has an animal shelter. Love our pets. But please pay attention to this, because we've asked, our street outreach doesn't go into the encampments. There is becoming a higher level of fear about people being found in their encampments and what that means. And so really trying to think about the safety and security of the individuals we see as this continues to ramp up. Not really sure where we're going with this. The Attorney General can very much step in as written by the legislation to take action against communities for not doing this. And so I just wanted to make everybody aware that might be harder to meet people outside, and that they have been warned, and it is picking up right now. You can't sleep here, you need to get up and move, and this, that, and the other, and that will just continue to pick up. So those are the 2 advocacy alerts I have that realm in my world. Anybody else have anything to add? Because we're in this field and we see a lot of stuff.
Okay. I'm Kathy Winston, and I'm with the Northern Kentucky Health Department, and I work primarily with the WIC program, the Women, Infants, and Children's program. And I would say one challenge that we really face is trying to get pregnant women in for WIC services. WIC, I don't know how many of you are familiar with WIC, but the Women, Infants, and Children's program provides healthy foods and nutrition education for families that fall under 185% of the poverty level. And WIC is one of the few government programs that can say we actually have studies to back up that we make a difference. And where we can make the biggest difference is if we get women in while they're pregnant for WIC services. Because if you have a healthy pregnancy, a healthy delivery, you're going to lower medical costs and you're going to have a healthier community. So if you all have prenatals, please send them to the health department. We provide healthy foods, lots of good nutrition information. The flyers are over on the table. Once the infant is born, then we are providing formula and baby foods, and we're providing fresh fruits and vegetables, now all kinds of healthy foods. So please refer your prenatals to us as much as you can.
Hi again. Not to beat a dead horse, but at Mentoring Plus, we are trying again to get more resources for youth substance use. We actually are going to be, hopefully next year, creating a program that maybe can help advocate, educate, and then also rehabilitate youth who have substance use issues. But in the meantime, if anybody has any resources, or if you're also passionate about that as well, please email me. Again, not to beat a dead horse, but I do talk about this a lot with youth and addiction recovery and how there are not a lot of services. So please feel free to email me if you're also interested. Another thing I wanted to touch on, a trend, is that we're also getting a lot more referrals for truancy. So I'm looking to see if there's maybe a way that we could help with kids who are currently truant. I do actually, tomorrow we have a meeting for the school student support affinity group. If you guys are a part of that, please attend that. That's one thing that I want to tackle is truancy, because we're getting a lot of referrals and I'm seeing an uptick in truancy for a lot of schools too.
Thank you. Can you make sure they go to our website and put that as an alert so that it gets to the broader group, because we're really wanting to lean in, and you can set up how you receive the alert.
I'm going to talk about an alert too. So you mentioned the housing data walk. We're holding two, one in Erlanger and one in Independence. The one in Independence will be this Thursday at the Senior Citizens Home in Independence, and the one next week is going to be at Erlanger Baptist on the 22nd, or the 27th, I believe. And we walk people through all of the big portions of those data because we know that it's really tough to read. But we're inviting community members. I'm going to have somebody from our team send those out as SNA alerts as well, because Brighton Center is offering some, what did we call it? A stipend up to $50 for having their voice heard. So if that's something that your clients are interested, if you're interested, please come out, talk to us. I'll be there. Maybe Giovanni will be there. Who knows? I don't have the Gallatin County one, but I will find out, and I'll tell somebody to send that out too.
And there, in the housing task force that came out of the housing study, there is existing housing committee, new housing committee, public relations or communications, and then I think financial, like funding and how to do this. On a statewide level, legislators have created a housing task force, and they are meeting. And Judge Moore was actually presenting not this past week, I think, but the one before. So there is a lot of conversation regarding this. I think for me, the other thing is we really have to get beyond the NIMBY. The single housing is not what our community needs. We need a lot of mixed use, and we cannot be afraid of that because we have companies that very much are paying $40,000 and need to have people live close to those jobs. So.
I just need a resource. I have a participant who we were able to get some funding from St. Vincent and KCAC, but he still has quite a substantial electric bill, and I've been trying for the last couple of weeks. Today is the deadline. So if your organization has any kind of resources regarding utilities for electric, please come find me. Thank you.
Probably one other one. If anybody, Amanda, if she was here, she'd probably be happy that I said this. There is an alert out, so for overdose in our community, we have seen an increase in Boone, and now that alert has been expanded to like 7 counties. So the state tracks us in addition and support here. So there is an increased use right now and overdose. So to not use alone and follow that information to share with the folks that you serve.
All right. All right, well, we just have a couple of more points, and that is some thanks to our tech team. Thank you, technology team, for our hybrid meeting. How great is that? For the photographs that have been taken, for all of the help and support to pull our meeting together today. Bobby, as always, thank you so much for the support you provide for Safety Net Alliance. We appreciate your service. And again, thanks for the Lakeside Christian Church, Matt Westwood in particular, for allowing us to come and spend this time together. It's been a good day to be together, right? And if you have the chance, be sure and hit that resource table. You know there's a lot of stuff back there that'll be helpful for us. And we'll look forward to seeing you again on September the 18th, 12:30, right here. Thank you.